Causes. Important causes of cardiovascular disease include atherosclerosis, when fatty deposits accumulate in the arteries. Damage to the circulatory system can also result from diabetes and as the result of other health conditions, such as a virus, an infection, or a structural problem that the person was born with. It often involves high blood pressure, but this can be both a cause and a result of cardiovascular disease. Types. Cardiac, or heart-related, diseases and conditions include angina, considered both a cardiac and vascular disease. Arrhythmia, where there is an irregular heartbeat or heart rhythm. Congenital heart disease, when a problem with heart function or structure is present from birth. Coronary artery disease, CAD, which affects the arteries that feed the heart muscle. Dilated cardiomyopathy. Heart attack. Heart failure, when the heart does not work properly. Hypertrophic cardiomyopathy. Mitral regurgitation. Mitral valve prolapse. Pulmonary stenosis. Rheumatic heart disease, which can be a complication of strep throat. Vascular diseases are diseases that affect the blood vessels, the arteries, veins, or capillaries. They include peripheral artery, arterial, disease. Aneurysm. Atherosclerosis. Renal artery disease. Raynaud's disease, Raynaud's phenomenon. Buerger's disease. Peripheral venous disease. Stroke, a type of cerebrovascular disease. Venous blood clots. Blood clotting disorders. Prevention. The majority of CVDs are preventable. It is important to address risk factors by consuming less alcohol and tobacco, eating fresh fruit and vegetables, reducing salt intake, avoiding sedentary lifestyles, particularly among children. Bad habits during childhood will not lead to cardiovascular disease while the individual is still young, but they can lead to the accumulation of problems that continue into adulthood, resulting in a greater probability of having a cardiovascular disease later in life. Children who eat a lot of salt have a much higher risk of hypertension when they are adults, as well as heart disease and stroke. Parents should also keep a close eye on how much saturated fat and sugar a child consumes. Does aspirin protect from cardiovascular disease? Aspirin, also known as acetylsalicylic acid, ASA, is a medication that is generally used to treat minor pains. It is also used as an antipyretic, to reduce fever, and as an anti-inflammatory. Aspirin has become popular as an antiplatelet drug, to prevent blood clots from forming. High-risk patients take it in low doses to prevent strokes and heart attacks. Aspirin is also given to patients after a heart attack to prevent cardiac tissue death or heart attack recurrence. A major problem posed by aspirin therapy for patients at risk of heart attack, stroke, and other cardiovascular events is major bleeding. A considerable proportion of patients with diabetes have a high rate of major bleeding, regardless of their therapeutic aspirin status.